If you've been told you need strengthening exercises for knee arthritis, you're right. But did you know that yoga, yes, yoga can work just as well for knee pain relief? In fact, a recent study found yoga was just as effective as strengthening exercise with added benefits of flexibility, stiffness, and even quality of life. But here's the catch. Not every moment is the right time for yoga. I'm Dr. Tammy Penhollow, a spine and joint care expert at Precision Regenerative Medicine. In this video, I'll break down what the science really says, when to do yoga, when to stick with strength training, and how combining both may give you the best results for your knees. So let's break this down. Yoga versus strength training. This reference is JAMA Network Open 2025 trial. Both are beneficial, but here's the deal. We want to get a little bit of more details of this. So it's 117 participants, 24-week program, so a half a year. They did yoga versus strengthening exercises, equal time and equal contact with a therapist to decrease any issues with confounders. The results: yoga was not inferior to strength training for pain. Yoga was better for stiffness, better for function, and better for quality of life. Safety: there were a couple more adverse events in the yoga group, like 16% versus 9%, and these were minor, non-serious. It just goes to show, while we're going to talk about the reasons for understanding when's the perfect time to do yoga. So let's talk again about some benefits of yoga. You gain increased flexibility, you gain balance, and you gain mindfulness. It may be ideal for those who are older, those who are beginners. Maybe you're a little bit afraid to get in the gym and start lifting weights, those with mild health concerns. Yoga also tends to foster more motivation and socialization if you're doing it in a group setting. On the other side, strength training benefits, builds muscle. Those muscles then support your joints. Think of the nice big quads that are around this knee, or the calves on the backside of this knee that are supporting it and providing some structure. It then improves stability and long-term protection, finding that it may be better for those younger or super active patients. When not to do yoga. If you're in an acute pain flare, say you just went for a big hike and your knee is swollen, this is not the time to now try to put it through all those extra range of motions in holding poses such as down dog. It's also important to see your physician and see your physical therapist, your MPT, to make sure that you've got the right foundation to start a yoga practice. And the PT can then tailor these safe re-entries into yoga or into strength training after a flare. So let's talk a little bit about why we even want to do this. Well, the stats are not in our favor. In 2019, about 528 million people worldwide were living with osteoarthritis. That is a 113% increase since 1990. So in just that 30-year span, there's a major increase in osteoarthritis. The knee, the most commonly affected joint. So there's a reason for this. 165 million cases of those 528 million are the knee. More recent data from 2021 reports that about 375 million people globally have knee osteoarthritis. 30 million a year is new. And this attributes to 12.02 million disability-adjusted life years. This is putting years on your life. This is taking away from quality of time with your family, time spent doing the things you want to do, such as traveling, walking on those cobblestone streets, playing with your grandkids, doing your own physical activities, even getting up and down from your chair so you can do your activities of daily living, such as the laundry and cooking and cleaning. So age standardized prevalence in 2020 states that the world estimates of osteoarthritis 5.5 to 8.6%. Another estimate says it affects 600 million people worldwide, or 8% of the global population. Also, if we bring it into the US, about 1 in 5 US adults, roughly 53 million people, have some form of osteoarthritis, and that prevalence is around 11.5% if you're 35 to 49, and if you're in the 50 to 74, it's 44%, and if you're over 75, then it's 54%. This is impactful. This is affecting your life. We all know, and I will just reiterate a few things, that every single major international osteoarthritis guideline from Nice and the American Academy of Orthopedic Surgeons recommends exercise therapy as the first line of treatment for OA of the knee, of the hip, and the hand. And this is based on 80 randomized controlled trials spanning several decades. Just weeks ago, in August 2025, a guideline updated strongly reiterates exercise therapy is the cornerstone of physical therapy for knee osteoarthritis. So whether you choose yoga or you choose strength training, we need to move. Motion is lotion and movement is medicine. Exercise can reduce the pain. It can improve the physical function by up to 40% of adults with either hip or knee OA. Broader benefits: improve range of motion of the joint, improve flexibility of the muscles and the strength of the muscles, improve balance, and therefore you reduce your risk of falling, breaking a hip, and then the risk of 25% of the people who break a hip are likely to die within that first year of breaking the hip. It also supports weight management, mood enhancement from those feel-good serotonins and dopamines that are released after we exercise. And specifically when we talk about the knee and strength training, it can enhance the integrity of the cartilage. Remember, this blue part is the cartilage. It can help by building the muscles. Therefore, the muscles absorb the shock and put reduced pain specifically on the joint itself. So, improve functional mobility, reduction in pain, reduce load on joints, and enhances overall quality of life. So long as this program is tailored for you, for your intensity, for your frequency, and for you specifically. Say you've got an ankle problem too, or a hip problem too, then we need to take that into account. So the gist of it is, whatever you're interested in doing, whether you say, I'm just not a gym rat, I don't want to lift weights, I'd rather do some mindfulness yoga and some stretching, it's not inferior to strength training. Or if you love crunching on the weights in the gym and you want to build all that muscle, it's not inferior to yoga when we're talking about knee osteoarthritis. If you like this, if you want more of this, please like and subscribe. If you've got any questions, please drop them in the comments below and let me know how you'd like to integrate these stats into your next program. If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.